Hi, guys. Today we're going to talk about advocating for your patient. So, in this lesson, we'll cover exactly what being a patient advocate is, what kind of skills you should have to be an effective patient advocate, and most importantly, how we can be a patient advocate. Let's get started. So, what does it mean to be a patient advocate? It means that you're supporting, protecting, defending, and speaking out for the rights and interests of your patients, particularly those who can't fight or speak for themselves. As nurses, we have a commitment to empower our patients and their family members during our time caring for them. And this means that sometimes we have to make waves when it comes to doing the right thing. So, as we're talking about doing the right thing for our patients, we should talk about how and why every nurse should be an advocate. Now, there are times where difficult choices are going to have to be made, and sometimes the information isn't as understandable or as free flowing as it may need to be. So, nurses as patient advocates actually help to facilitate those tough discussions and the decision making process. The reason that we advocate for our patients is for their to improve and enhance the patient's safety and their care, but also to promote patient rights. Now, evidence based practice is the basis of facility policies and procedures. Through trial and error, sometimes we find that those practices aren't always in the best interest of all the patients that we come across and that changes need to be made. So, without recognizing the problem and pushing for changes to correct that problem, then those policies stay unchanged. It's actually the voices of patient advocates that most often get these policy changes that are necessary to provide patients with the optimal care. So, what skills does it take to be an effective advocate? Well, first off, you need to have good problem solving skills. What this means is that you have the ability to identify an issue and develop a plan and strategy to correct that issue. Now, most people have this ability, but they tend to rely on someone else to kind of get that ball rolling. So, I want you guys to understand that in advocacy, sometimes you have to step up and be that change agent. Okay, now advocates are also very good communicators. They adapt their methods to communication to their audience, and they know how to present the facts of the situation and address their goals clearly while still being able to command the attention of that audience. Now, with that being said, advocates also have to be influential. Now, look at what they're doing, okay? They advocates will radiate confidence and competence. They are proven to be extremely trustworthy when it comes to being able to collaborate with other people and other groups. There has to be compromise more often than not, and understanding that advocacy is not just take, 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 take. It's a give and take situation. We may not always be able to get everything that we want right away, but whatever positive steps that we can make to support and protect our patients is always going to be a win. Okay, which is why patience is a virtue, but it's also a very necessary skill to have. We're constantly compromising and negotiating, and some of those ideas will take time to come to fruition. So we need to really be cognizant of that as well. So now that we have all of that down, let's talk about what it means to be a nurse advocating for patients. Okay. So you've all probably heard of the ANA's Code of Ethics by this point. The Code of Ethics is really a guide for nurses to provide care and maintain ethical standards. What you probably didn't recognize was that the ANA actually uses the words protection, promotion, and advocacy in their definition of nursing. So everything that we've discussed up to this point is included in our scope of practice. Um, the Code of Ethics is really an extension of the nursing definition and kind of gives us a closer look at our responsibilities in relationship to it. Another extension of the ANA Code of Ethics is what's called the Health Advocate Code. Now, this code is a statement of ethics and expectations for best practice of patient advocates. It's right there in the word. Okay. Now there are several pieces of this code that match ANA, and then there are others that just kind of add on to it. But you can find both of these codes online for review and see how they compare with each other. So, nurses can be patient advocates in various forms, one of which is being a committee member. Now, while you're in school, I'm sure you hear it all the time. Join a committee. If you can, join a committee. It's great being a committee, right? Every facility has a choice of committees that nurses can sit on to discuss policy and initiatives around the facility. Okay. These discussions can be related to adverse events like quality assurance for medication errors or falls, or just bouncing off ideas off of one another to improve patient care and safety, like shortening timeframes for answering call bells or restrictive measures. These committees are also used for resource development for staff members. Maybe there's an equipment upgrade that we need to take a look at, or maybe we need training on a new equipment that we received, or maybe the staff requires professional development in the form of a class or some sort of organizational event. At my job, we have nursing expos to help nurses refresh their clinical skills because maybe they don't use them all the time, or maybe a committee recognized that it's an area that really truly needs overall improvement across the board, right? So there will also be times that changes are made to facility protocols and policies, depending on the specific goals of the committee. Either way, no matter how you look at it, patient care and safety are always, always, always going to be a collaborative effort. And they start with someone, hopefully you, recognizing there's a problem. So the other ways we can advocate as nurses is in the actual organization we work in. Now, remember I said earlier that sometimes we have to make waves. More often than not, this is where it comes in. This particular type of advocacy within the organization comes directly from the patient care area. The reason for this is, nurses spend most of the most time in a day with patients than anyone else, and they get to know certain aspects of those patients pretty well. So we're going to be the patient's first line of defense. So it's important to understand that we should always be assessing our patients in anything concerning their care. So this includes medications, treatments, all the way up to probably past their diet. Okay. As a nurse caring for a patient, anything that's not normal, including patient complaints, should be reported using the chain of command. Now, in some cases, this chain may actually require the physician to be the first point of contact. But for the most part, most situations, you're going to go to your supervisor or manager. Just make sure that you know your chain of command in your facility. Okay. Now, for instance, if you have a patient who has, say, abnormal bleeding for an extended period of time and they're being discharged, but there wasn't any treatment performed and their labs are still abnormal, you might want to speak up to that physician about your concerns. Okay. Now, with that said, because advocating in this nature can be very passionate, it's very interchangeably used with the word fighting for our patients. Obviously, this has a very negative connotation. What that does, creating that, using that word and using it interchangeably, it creates a reluctance for other people to follow suit because they can be labeled as problematic or aggressive. So there are going to be some who just are afraid to speak up. Okay. New nurses in particular, they tend to be less likely to speak up because they're still learning. They're new, they fear being wrong, so they often second guess what they see. This will be you at some point. And it's possible that there's a knowledge deficit. Okay. We don't learn everything that there is to know in nursing school. Some things we don't see, some things we don't know. Understaffing. This can really cause nurses to overlook something in their patients as well. Having a lopsided patient assignment really generates a different level of care where attention is not provided adequately enough to catch the small issues all the time. So these are all barriers that can potentially be detrimental to patients, staff, and very possibly the facility if it's not rectified quickly. So let's review some key points. The whole idea behind advocacy is that someone saw something that wasn't right one day and fought to make sure that no one else endured that issue again. If you see something, guys, say something. This I cannot say enough. I know you hear it a lot on TV and policies and politics and law enforcement. If you see something, say something. It applies here too. It is a form of advocacy. Nothing will change if you don't say anything. Okay. We don't want you to just keep seeing it and just keep going with the flow because that can be detrimental as well. So if you see something, say something. Communication. This is a must-have skill when it comes to advocating. Okay. You are the patient's first line of defense and you will need to speak up, especially when they can't. Okay. And lastly, you can actually choose to be an advocate in many different areas. If you want to see changes made throughout the organization, find the committee that you're interested in and join in to work on those policies and initiatives. If you're advocating for a specific patient, be sure you understand how to navigate through those barriers. It could mean a huge difference between a positive or negative experience for that patient.
Thanks for watching another nursing.com lesson. Click the link below in the description to watch thousands more lessons over on nursing.com. Also, be sure to hit the subscribe and the little bell to make sure you're reminded when new lessons come out. And if you want to just keep watching more lessons, go ahead and click this video over here to continue learning. Like we always say here at nursing.com, happy nursing.